Dr. Jeff King. Good morning, Jeff. How are you?
Well, thank you.
Great. Now, someone told us that you're going to be thrown in jail.
For good.
Throw away the key.
Yeah.
That's right.
So what's going on? You're a participant of the MDA lockup.
That's right. Helping some kids in the local area for muscular dystrophy, get them to summer camps and help pay for some of their medical help and whatnot.
So you need bail money.
Yeah, give me your money. Show me the money.
Do you literally have to, I don't know this part of the program, that literally have to go somewhere and be...
Yeah, I'm going to Krieger's Pub right here in Quincy.
Oh, you poor thing.
That's terrible. They're going to feed me and...
bar food,
in bars.
Food,
yeah.
You can take your tin cup and go along the bars.
That's right.
And then do people come down and make their donations or call in, or how does that work?
They can do either. We're collecting at the King Clinic.
And you have to call people, don't you, and say, can you give me some bail money? I think you have to call while you're there.
Yeah. Yeah.
They give you more than
I
one
have
phone call.
A certain level that I have to meet, and if I don't, then they'll hold me, and I have to call to beg, borrow, and steal to get out of there.
All right, and that'll be September 1st, but you're collecting money in advance.
Sure.
Future
right now.
bail.
That's right.
And you're right. I mean, the things that we learned: $25 for a flu shot, $65 it costs for 1 minute of research. So doing this will certainly help MDA. So thanks.
And our topic today is kids. And you know, we've talked off air a number of times about services you do provide for children, which is just amazing to me. I remember when we first day we met, you talked about how you can even treat children who wet the bed at night. And I have to start with that because it just sounds so amazing. What's the thought behind that?
The thought behind that mostly is a weak bladder or muscles that haven't developed yet. And nerves that go to bladder from that area come from pelvis, low back, stuff like that. So oftentimes, about 70% of the time, children develop this problem because as they learn to walk, they hit the deck and fall on their posterior a few thousand times, and it creates some dysfunction. That's 70% of the time.
Wow.
Now, there's some current literature that also suggests now that children actually have an allergic reaction to milk.
And that can cause bedwetting?
Yes. Yeah. That's brand new stuff, hot off the press. So that 30% that's failed from a mechanical problem, look to milk. Could be a milk problem.
Interesting.
It is fascinating. It's brand new stuff.
I know also you talked about with babies that you can treat them for colic. Because that's one of those mystery things that no one knows, just the baby screams and cries that they're being, murdered or something.
Yeah. Yeah. In fact, my infant had that. So, upfront and personal. Yeah. That's pretty easy. Usually that's associated with birth trauma.
It is? It's like an emotional, it's a nerve. It's a nerve ending issue?
So it's a mechanical trauma. It's very difficult to be born. Think of the uterus being a gigantic...
Careful now.
Yeah. It's this big, huge muscular tube, and when it contracts, it does so with quite a force.
And it's pushing on the baby.
Sure. And it squishes the baby's head. The skull isn't this hard, rigid thing that we have now as adults. It's nice and soft and full of cartilaginous plates. And they tend to get warped and torqued, and that translates force directly into brain stem, stuff like that. It's very uncomfortable, makes baby upset, and he starts hollering.
So the baby really is in pain with colic.
Sure. Yes.
Oh,
I always thought it was just some emotional thing that.
Well. Yeah. But
okay.
That's
but
not
what?
me.
But how do you? So yeah, how do you treat that then?
Very gently.
Yeah.
Osteopathic manipulation in the past. When we talk about manipulation with an infant, we're talking about gently holding pressure into the skull to reform it, to get mechanical pressure and deformation off the brain, most notably, and the upper cervical spine, way up at the top of the neck. That area gets deformed very easily, mostly through being born, with someone helping the child be born. If a mother has a forceps delivery or any assisted delivery at all, that kid's going to be traumatized no matter what. All right.
So now, what's the youngest patient you've ever worked with?
Matter of minutes old.
Really?
Yeah. But it was obvious. The head was contorted. Forceps delivery, that's a big one. And it's not the allopath's fault. It's not the medic's fault. I mean, the medic is usually sweating. It's all they can do to stay calm as this process of nature occurs, and they're in a panic to make sure that everybody lives, because it is quite traumatic, especially for the baby. I mean, mom's recumbent. She's lying on her back. It's very difficult. The baby has to ascend through the birth canal, maybe on the plains of the Serengeti, naturally women would just squat and gravity-assisted delivery. It'd take a matter of minutes. Now it can take hours, days. My own wife was in labor for 3 days, so breech presentations, it's difficult to get here. So.
Wow. And then there's milestones in a kid's life. They're born, and then I'm sure there's certain periods of development.
Sure.
And in your business or your profession, you have to kind of monitor that and guide kids along.
Absolutely.
It's kind of interesting. How about to children with, speaking of MDA and muscular, dystrophic diseases and things, is that something you as a chiropractor are able to kind of sense when something is going on?
Sure. Well, there are telltale signs that you can see physically upon evaluation. But in terms of a clinical therapeutic intervention chiropractically, no help. That's a genetic fault. That's a problem that can't be rectified that way. Chiropractic's great, but it is a limited tool, just like anything else.
But even in relief or in
maybe
maintaining a quality of life, can you make a difference?
Not much, to be quite honest about it. Yeah.
But the good news is that you can detect it, because often that is the case. Your child's walking a normal walk or playing a ball game, and the next day they're having some challenges, from what I understand. And that's something you could kind of determine and guide them to the proper means of.
Fairly quickly.
That's good to hear.
What other kind of baby, toddler, young child issues do you deal with?
Mostly colic, ear infections.
Ear infections, you can help the drainage or
Yes, help drainage.
Oh.
Help things drain properly.
Because every kid has ear infections. I mean, it's a way of life, it seems like.
Yeah, but, literature suggests that ear tubes that are implanted perform quite poorly in helping them drain mechanically. So it can be done by a competent chiropractor or osteopath. Not one that's going to yank on a kid's ears. Don't have any odd thoughts like that. We're very gentle with children. Mostly we just hold gentle forces into the body, and their bodies are very plastic. They deform very easily, so it takes nothing to help a child, and very quickly too. Typically, if I have a very sick child, even colicky, very discontent, screaming and yelling, can't suckle, won't feed, can't go potty, it might take 1 to 3 treatments, and that's it. The kid's on its way.
They stop?
It's quite miraculous. Yeah, it's seemingly miraculous.
For a parent who has a colicky baby, I mean,
it's a big deal.
And they hear that and they go,
Believe
"Oh
me.
my gosh," that's like a miracle, because it's so tough for the parents and the child. I mean, it's just a
For everybody.
horrible situation.
And the dogs and cats and the chickens. Screaming infant. Oh my, that's tough.
Now, if anyone has a question, email is probably a good way to reach you.
Yep, we get a lot of emails, and we handle them right away by me personally. kingclinic@aol.com.
And how about a phone number?
641-0644.
And that's to make an appointment or consultation or whatever.
Yep.
All right.
Great.
Very good. Very interesting. Thank you, as always, Dr. King.
Thank you.